Assalamu alaikum, everyone. You are now tuned to Shakil Company on America's Islamic Radio. Today's interview is sponsored by JG Advisors, the Mugs and Beans Company, and Mohammed Dar from Westbury Toyota. So today's a two for two kind of interview day. Today we have none other than Richard Simister from Move Evolution. Is a wonderful physical therapist out in Brooklyn, right in the heart of Brooklyn. I think what 3 minute walk from Atlantic Terminal.
At least.
At least a 3 minute walk from Atlantic Terminal. And he's one of these guys where when I first met him, I was astonished to meet him. And I'm bringing him onto Shaquille and Company on American Islamic Radio to astonish you guys as well. Richard, how are you doing today?
Excellent. Superb.
How's your day so far?
Sweet.
Awesome. So, Richard, can you please introduce yourself to our viewers?
My name is Richard Simister. I am a Brooklyn resident. I am a physical therapist, have been a physical therapist for about 20 years, going into my 21st year, and my studio is located in Fort Greene, Brooklyn.
Awesome. So, Richard,
Yes.
please tell us a little bit about yourself. Who is Richard Simister? How did you become the person you are today? Very straightforward.
Person of the physical
The,
therapist.
I just want to know the person first. We'll talk about the physical therapist a little bit.
Oh man, I'm an off-the-wall nerd, Gemini. Always been to the sciences, biology. I was always a geek, always with animals, always into the human body. Always sought further learning, greater learning, continuing education. Kids I hung out with in grade school, high school. You know, we hung out, played sports, a lot of sports, but after a while, I could see that there was a different path for me. And often I was a little bit alienated because I was always into the books and sciences, but I found my nerdy group after a while. And after that, undergrad, grad school, I was an English major, literary major. Met an athletic trainer after I hurt my knee, and he turned me on to the field of physical therapy. And after that, I just started going after it.
So, how old were you when you decided to become a physical therapist?
23.
23 years old.
Yeah.
You just went, hey, I like this. This is what I want to do for the rest of my life. What was that like?
I was frustrated. I was a writer. I was a writer for a few years, and it just wasn't what I wanted to do full time. And again, I met that athletic trainer. He showed me what he went through, his career, prerequisites, studying, and I knew that was for me.
Okay.
Yeah.
So, you 21 years, you're a physical therapist. What has been the number one challenge since you started to now?
That's the easiest one. Every physical therapist will tell you the same thing. It's insurances, the reimbursement. Reimbursements over the last 10 years have dropped 10, 20, 30%, but the physical therapists are working harder, longer to try to keep up the volume to maintain, and it's a dying system.
The
The
insurance
insurance
reimbursements.
industry is a dying system, and physical therapists are either going to close down shop, increase the volume, or do what I did and transition to a cash-based, out-of-network facility.
So, let's say somebody comes in with an injury and they get into a car accident, right? And the doctor says, hey, you have to go to physical therapy. There's a stigma out there, like, oh, they're just gonna take my money. I don't need physical therapy. I feel fine. Describe why that person might actually need physical therapy and continue on that path, opposed to saying, "Hey, I'm fine right now."
Well, it depends on the injury, depends upon the person and the physical therapist. There are so many different realms of physical therapy. There are post-surgical, balance, geriatric, pediatric. But for someone in a motor vehicle accident, first I'd have to speak with them and find out what is their injury. Can I help them? There are often times they don't need to see a physical therapist, but the first is to have the conversation and come in for the initial evaluation. There will be some physical therapists, no matter what your injury is, they'll treat you and they will take your money because it's based on volume, volume, volume. There are a few great physical therapists who will look at you and say, I can help you. I can help you, or you know what, I can send you to someone who can help you.
Okay.
So it depends on the individual. But as far as I am concerned, I'm a musculoskeletal specialist. I'm a manual therapist
What
specialist.
does that mean?
It means I work on your muscles and joints. If you come in with a particular injury where you have a tear, a strain, joint injury, that's my realm.
Okay.
That's my realm.
So basically, let's say like somebody keeps getting stiff necks.
Stiff necks.
That's you. That's you.
That's me.
Okay.
That's me.
You know, I have a stiff neck problem.
I know you do.
It's my posture, I guess,
Yes.
right? So,
And the work you do.
and the work I do.
Yes.
So, Richard's actually my physical therapist. I go see him once every 6 months. And he says, Kev, you have to come back. And I barely go because he's out in Brooklyn. I'm super busy. Sorry.
Busy's
We
good.
might get a session in while we're here.
Busy's good.
But okay, now another question I have for you, right, is let's say you're somebody, one of our viewers who are watching this, who is hearing this, that, oh, insurance reimbursement sucks. It's volume. What are the rewards of being a physical therapist? Why would somebody want to go down that path?
It's seeing the evolution of say you came in and your neck is stiff, you can't move in a few visits, even at one visit. If you say, Richard, I can move my neck 50% better, it's all about the client outcome. It's all about the success story. If you can do something better, perform better, that gets me high, that gets me excited. That's why I do it.
So seeing somebody from immediate pain to immediate relief, is that what it is?
Pain relief or more mobility, you move better, you perform better. You can, Richard, I'm able to go up these stairs. I can swing the racket 50% harder than I could last week. That makes me happy. That's why I do it.
That's interesting. And what about all these other physical therapists that are out there, right? How can you distinguish between the one that are just doing it for profit and somebody like you who's doing it to actually help? How can you distinguish between those two?
Myself as a therapist or a client? What's
As a client, so I'm a client, right?
Yes.
And I'm looking for a physical therapist, right? My doctor says, hey, you have to go to physical therapy. How can I know which one is the right fit?
That's a great question. I tell when clients come to me and say I just can't see them or they're too far away, I say, listen, call the studio. Ask them, do you specialize in ACLs? Will I be seeing the same therapist the whole time? Am I going to be seeing the therapist one-on-one or for a few minutes and then I get transferred to an aide or an assistant or another trainer? So have almost a script of questions available before you call and then see how they answer. If they answer directly, great. If they say, well, I'm not too sure, or let me have you speak to someone else, they kind of him and haw, you may want to go check someplace else.
Somewhere
Yeah,
else. And you're out in Brooklyn, right?
I am. Fort Greene, Brooklyn.
Where exactly? Use the address for our viewers.
Ooh, let me give you landmarks. There's the BAM Theater. Is Not Ray's Pizza.
2 blocks
Brooklyn
away.
Hospital. The Alamo. I'm right in the middle of heart of Fort Greene.
Okay.
Yeah.
And how long have you been there?
Going into my 6th year.
6 year.
Yeah.
Where were you before that?
I was in Williamsburg.
Wow. So you're a Brooklyn guy.
I love
Stay in
Brooklyn.
Brooklyn.
I love Brooklyn. Yeah.
So what are your clients like? Like what kind of injuries do you see on a day to day?
I commonly see a lot of knees, necks, shoulders, a lot of lower backs, and it's really based upon the culture of Brooklyn. People sitting, standing, the movers. I see similar injuries while I'm there. So a lot of knees, a lot of menisci, a lot of post-surgical. My specialty is shoulders, knees, and back. So if I do see someone that I'm not comfortable seeing, I will refer them out, but that's what I see the most, knees, shoulders.
So let's say now just to bring it back a little bit, let's get a little more serious, right? This is your 21st year being a physical therapist, right?
Yes.
People are graduating this year as a physical therapist,
Yes.
right? What is the difference that you've seen with new people and older people in the business? Because there's always a trend that changes every 10 years with different skills. How do you stay current? Or are the trades that you already know always going to be the same?
Okay, that's what I see the most with the new grads who are coming out. They have it is trendy. It is trendy, and they have more faster or screening techniques. So when I was going through school, it was a little bit more precise. Not that they're not precise now, but there are different ways of screening individuals, so you can get to the. It's more of a general application going to specific. So you'll come in. And I'll do a gross functional screen on you. See how do you move? What's your mobility like? And then we'll break it down from there. That's not the way we're actually taught. I was taught about 21 years ago.
So it's the screening of new patients.
It's a screening of your body. It's a body screening. So it's more of a functional assessment, a screening of how you squat, how you lunge. We take these 7 fundamental movements, and I always miss the last one. It's squat, lunge, press, hinge, walk, carry, I forget the seventh. And we look at how you move. You come in and we'll screen you generally first. And then if we see something's broken or something's awry, we'll do a breakout session and do some specific movement testing there, manual muscle testing, range of motion testing. Yeah.
So as a new patient, right? Or not even a new patient, you see somebody on the train.
Yes.
Because I've seen you've been posting a lot of pictures on your Instagram with somebody looking at the phone like this, right?
Yes.
What are the negative benefits to that? Negativity to that, where you're always looking down at your phone, your posture is incorrect. I mean, what are the little tips and tricks that people can do to, make themselves feel a little better?
Okay. Your body is going to adapt to what you're doing all day. So if you're hunched, if you're slumped, if you're leaning, your body, your tissues are going to adapt.
Okay.
So I tell people, if you're going to be on the computer all day, reverse the posture. Have some sort of exercise or training routine where you're working on your extensors because your flexors are always turned on. If you're reading, texting, bring everything up to your face so your head is actually balanced up. Because the longer you're going to be down here, the longer these muscles start to tighten, and it leads to all other issues down the spine, down the back. So one is to be cognizant of what you're doing while you're doing it, so you're not going into a bad posture. And also outside of work, try to reverse that posture with some sort of exercise or training.
That's awesome. So do you do any of these like workshops throughout the year where people can come in and not be a patient, but come in and get like a little informative session on, how to adjust your posture? Do you do that anymore?
I do. Right now I have a new promotion going. It's partner pampering, because I'm trying to empower my clients. So if they bring their spouse, partner, friend, workout partner in, it's basically 2 for 1. I show each person how to treat the other person, whether it's soft tissue, stretching, active range of motion, compression. It saves them time, saves them money, and what I accomplish in the studio, they can actually carry on at home.
So I see your logo here behind us, which is so wonderfully beautiful put, right?
Thank you.
I see sports and dance rehab. What's that about?
My clientele, they're dancers, they're athletes, people who run, jump, swim, rumba, salsa, Chicago style stepping. That's what I do. I'm a Chicago style stepper.
Okay,
dancer.
I didn't know that about you.
Yeah, I dance 3 times a week. And so the fact that I am a former athlete and a current athlete and I dance, I'm much able to, understand, sympathize, empathize with my clients and know what they're going through. I understand the movement, so it's easier for me to relate and treat them.
Okay. That's pretty cool. I didn't know that about you at all.
I have a lot of hidden secrets.
I can see that.
Congas.
Yeah, exactly, right? So you guys have been tuned to Shakil Co in American Islamic Radio. We have Richard Simmons here talking about his life, how he got into physical therapy, little tips and tricks. Richard, for our viewers, right?
Yes.
Who are listening right now, who are watching us, right? What is the one tip you would give them for their body, physical therapy-wise, that they should avoid to be better?
Avoid?
Avoid. A way of sitting, a way of,
It all depends on who you are, how tall you are, where you're sitting, what you're sitting. That's too hard of a question. What I would say is don't do it for a long period of time. If you're standing, don't stand for long periods. If you're sitting, get up and move. Don't stay static. Yeah, don't let your body adapt to what you're doing for long periods of time.
So keep moving.
Keep moving. Motion is lotion.
Motion is lotion.
Motion is lotion.
I've never heard that before.
It works. When you're in a cast, when you're in a cast for a long period of time, what happens to the joint?
Good stuff.
It stiffens up.
Yeah.
When you get out of the cast, you have to move. You have to move it. When you get out post-surgical, post-surgery for a knee, they put you in what's called a CPM machine. It keeps you moving, a constant CPM. I totally forget what that means. It's a constant range of motion machine for your knee because motion is lotion.
Wow.
Yeah. Keep moving.
It's like what they say, the noisy wheel gets the grease.
The noisy wheels, yeah. The squeaky wheel gets
the squeaky wheel gets the grease.
Yeah. Don't be a squeaky wheel. Always be greased. Always movement increases the amount of fluid pumped into your joints. You want to keep yourself fluid, mobile. Yeah.
That's awesome. Thank you, Richard, so much for joining us, for giving us.
My
So,
pleasure.
if somebody wants to come out to Movevolution for a consult, right?
Yes.
How could they reach you?
Few ways. Phone number 718-522-2658.
What's the number again?
718-522-2658 or moveevolution.com. And remember, the move and the evolution share the same E. Moveevolution.com.
If you guys are considering going to a physical therapist or somebody's referring you to a physical therapist, I recommend my guy here, Richard Simister. He's one of the guys that's actually worked on my neck, and I feel much better. So I don't have to go to him every day. I go to him once every 6 months.
Yeah, nice.
Because it works. He's awesome. If you guys are checking this out, make sure you guys go check out Richard Simister at Move Evolution. What's the number one more time?
718-522-2658. 1 hour treatments, one-on-one with your therapist. No aids, no text, no assistance.
You guys have been to Shakil Co in America Islamic Radio. Thank you guys for viewing. Enjoy the rest of your weekend.
Thank you. Thank you, Kevin.
Thanks, Richard, for coming out.